Living the life.
First, we're joined by Dr. Salma Maher, who's a specialist dietitian for London North West Hospitals. Salma is also the co-author of Carbs and Cals, World Food Book, the first picture guide for the BAME communities. Assalamu alaikum. But before we go there, I'm just going to show you a quick video of exactly what the NHS is doing to tackle the condition.
90% of people in the UK with diabetes have type 2 diabetes, and importantly, ethnicity is a major risk factor for type 2 diabetes. For people from a South Asian ethnic background, it's estimated that there's up to 6 times increased risk.
The Healthier You Diabetes Prevention Programme can support you in your lifestyle goals.
The topics that they cover in the session is obviously about the correct foods that you should be eating, the right diet.
Traditional South Asian cuisine can be really healthy, and there's no need to change to a Western-style diet in order to reduce your risks of type 2 diabetes. Whole grains are better for you than lower fibre types, so think about changing from white rice to brown rice. Choose coarse wholemeal atta, bajra or millet, besan or chickpea flour for your chapatis.
I found the program very useful. It's nice to have somebody who is a dietary expert and has the knowledge.
Enjoy beans and lentils such as kidney beans, black-eyed peas, chickpeas, masoor dal, tur dal, mung beans. These are all really healthy.
I've started exercising more. I swim every day, and now I'm running every day as well. I was a waist 42 when I started this program over a year ago. I'm now a waist 28. I'm a lot more enthusiastic about things, and I'm a lot more positive about things. I just want to do new hobbies and new interests. So I've suddenly sort of found my teenage years again. That's the most positive thing.
If you think you might be at risk of type 2 diabetes, go to the Diabetes UK Know Your Risk tool. You may be eligible for a place on your local Healthier You service. Right now, it's being done over telephone and video conference.
It's really easy to sign up online.
I don't know about you, on a lighter note, that actually made me feel hungry. Those rotis puffing up, absolutely fantastic. But let's get serious with Dr. Salma. Assalamu alaikum.
Walaikum assalam.
Welcome to the show. Look, fantastic video showing us obviously the work that the NHS is doing with regards to diabetes. Now, on that note, tell us a bit about the Healthier You NHS programme, Diabetes Prevention Programme. What's it all about?
So the Healthier You Diabetes Prevention Programme is basically a lifestyle intervention programme for those people who are at high risk of developing type 2 diabetes. And you can really benefit from this programme by learning about healthier cooking messages. And it also encourages you to do more exercise. It gives you all those lifestyle choices that we should be making. But at the same time, it also supports people who are thinking about losing weight. And it's a really family-centred approach that they're trying to offer.
Let's go back a minute to the first word that you mentioned, the high risk. What kind of people are we talking about?
So the high-risk category are really, we're thinking about people from a particular ethnic community group. So if we think about the South Asian community, the Chinese, the Afro-Caribbean, the Black Caribbean communities, they generally tend to hold a higher risk of developing type 2 diabetes.
And is that because of genetics, or what is that? Because we're targeting very specific groups here.
Correct. So it's multifactorial. There's lots of reasons why these communities are higher risk. And what we've seen is that people from the South Asian community generally tend to have a 6-fold increase of developing type 2 diabetes. And people from the Caribbean and the African community have a 3-fold increase of developing the risk of type 2 diabetes. But there's multifactorial reasons to why these communities have a higher risk. And sadly, we've seen through COVID as well that people with diabetes, obesity have had a higher mortality during COVID as well.
And talking about that, what is the difference between what's the difference between the different types of diabetes?
So there are two main types of diabetes, and the first type of diabetes is type 1 diabetes, and the second one, which we're all very familiar with, and the most common one, is type 2 diabetes. So 90% of people who have diabetes have type 2 diabetes. So what is type 2 diabetes? It basically means that our body is not producing significant or enough insulin, or if it is producing, it's not working as well as we would like it to. And this concept is known as insulin resistance, or both. You could not be producing enough. And what we see is that in diabetes, there are lots of long-term conditions attached to it. And what we really want to do is prevent those risks of developing those long-term conditions, such as, we've heard about the awful risks attached with diabetes, such as loss of amputation, loss of sight. It can lead to kidney failure. People really suffer, and it can reduce your quality of life as well.
And what about this Know Your Risks tool? Tell us about that.
Sure. So the Know Your Risk tool is a simple calculator developed by Diabetes UK, and you can go straight onto their website and look at your risk score. So it will calculate your risk according to certain measurements, such as your age, your height, your ethnicity, your weight, and be prepared to take your waist measurement as well. So they'll calculate a risk according to all these factors, and then it will give you a scoring of whether you are which risk category you're on. And according to that risk, then you can then self-refer or ask your health services to refer you onto the Healthier You programme if you are eligible.
Now, we saw a lot of activity from making rotis to changing your rice to white rice to boiled rice and brown rice and all the rest of it. Let's go through some of the preventative measures of making sure that you don't get to the stage of being, diabetic.
So if we just focus on some of the risk factors that are associated with preventing or getting type 2 diabetes, one of the risk factors is your weight. And if you are overweight, or if you think that you are above the cutoff of a normal BMI range, we need to start thinking about how we can help you to lose weight or live a healthy lifestyle. So the Healthier You offers you lots of healthy advice around food. It looks at the foods you eat in terms of your culture. So if we look at things which people in the South Asian community eat, they generally eat very healthy, they cook very healthy, but it could be that they're eating too much portion control. We could look at the type of flour and rice that we are eating and maybe swap to a more whole grain, a more wholesome option. So as Meena clearly said here, that maybe change your chapati atta from white atta to whole grain, or millet or bajra, just making simple swaps. And then it teaches you about food labels. It will teach you about how to make healthier swaps if you're going shopping with the family, and obviously thinking about looking at traffic light systems. So all those simple messages that making those changes in your diet, you can receive from the Healthier You.
I mean, look, let's get real for a minute, right? 3 things that have come to mind. Number 1, first of all, go to mum's house. She said, don't worry, nothing will happen to you. This is fantastic. These parathas are great. I made them just for you, right? Secondly, obviously, the amount of Indian, Asian, Pakistani restaurants and burger joints out there that, people just love food. And then, of course, the lockdown. You put all these things together, the last 6 months have been potentially a disaster.
I think this has been an opportunity for some people to actually think about their lifestyle. If you think about the lockdown, if you think about COVID, the key messages that were really coming out were improve your immunity, strengthen your immunity. This is a time that we really need to start thinking about eating better, doing more exercise. So there's 2 scales to this lockdown. There are some people who actually have woken up and thought about their health, their immunity, and changing those things because they don't want to have those fatalities associated with COVID. But at the same time, you have people who might be suffering alone, indoors, cannot go out, they're shielding. But there is a balance that we need to keep. We need to remember that we are living in a society where we socialize, we have family, we have cultural gatherings. And you can't change that. But what you can do is make those small everyday choices. You're not going to socialize every day. You're not going to eat out every day. But you are still going to have those healthier choices at home.
I get that. Look, but the other challenge is that, when it comes to eating better food, it's generally more expensive. That's another challenge that people face.
That's a very big myth that some people have, that eating healthy is expensive. But if we think about what is available, the markets, the allotments, people growing their own food, COVID has taught us something, is how to grow your own. Children know how to grow their own tomatoes, their aubergines, So if you think about eating pulses, you can buy tin pulses. If you think about buying vegetables, you can actually go to fresh farms and markets and get actually things much cheaper than your supermarkets sell. So there's no battle or discussion around healthy eating, is it more expensive? It's actually, when it comes to making those choices,
it's about making the effort, isn't it?
It's the barriers that come in the way. So it's the barriers, the friends, the family, the socializing that can come in the way. But
and also, you're just reaching out for things that are very easy for you, isn't it? I mean, it can be that case, but once you get those core cooking skills embedded into your children, into your family, it's not difficult to cook yourself. It's easier to order food, but even if you like to order, there are healthier options that you can order. But once you're motivated to make those choices, none of these things become a barrier. I mean, look, on that note, let's talk about a couple of things that are quite linked to this. And they mentioned exercise, number one. And the other one, we talked about myths, is diets.
That's right. So if we focus on exercise, the Healthier You program really focuses on diet and exercise. So as we've seen with COVID, some people are shielding, some people are not going out as much as they used to. We're not traveling to work. There are lots of things we can do at home. So in terms of, exercise from home, you can do things in the house, you can do things in the garden, or you can do your step counts, you can go for a walk. Gyms are closed at the moment. People cannot access leisure centres. So it's really about accessing what is available out there for you. And in terms of your daily walks, we're encouraging people to do 10,000 steps per day in order to keep that activity, that heart rate going. So there's lots you can do even during COVID. And then you mentioned about, in terms of making those choices.
Now, when I mentioned diets, I was talking more about going on a diet,
Sure.
Because, there's all these fads, there's drink water only, intermittent fasting, don't eat anything until 2 o'clock in the afternoon,
Sure.
Eat meat only, eat this only. There's so much of that kind of stuff going out as well. It's a bit confusing for people as well.
Absolutely. And what we have to remember, that no one diet fits everybody. Everybody is individual. We all have our own diet, our own preferences, our needs, our family. There are social, there is economical factors. There are lots and lots of multifactorials which will impact the way we eat and what we eat. In terms of your question about fad diets, there's lots and lots of research coming around which diets are suitable for people with diabetes or who want to lose weight. Any diet you wish to follow, you need to have the support. As long as you have the support and the support, the monitoring from your healthcare professionals, it will work. But once you don't have that encouragement or support, you're bound to fail. You touched on intermittent fasting. Now, this is a type of diet or lifestyle which has been known for centuries. If we look about the history and how our prophets used to eat, intermittent fasting, or if we want to call it the 5-2 diet, has lots of evidence behind it. It's very effective and efficient for those people who struggle to make those dietary choices. It's just about when we eat and how often we eat is what is going to help us lose weight. In terms of which diet you choose, it's really an individual choice. We want to give people the evidence and the choice. Then it's really up to the individual what is going to suit their needs. Right,
so I'm going to put the doc on the spot right now, okay? So just take us through, without getting too personal, but, what kind of things you might have eaten throughout the day? Or, let's say, breakfast. What would you think was quite a good thing to do? Breakfast, lunch, dinner? Just give us a sample of let's be real.
Sure. So like most South Asians, I could be at high risk. I've not done my calculator risk yet, but I am South Asian. I have some family history of diabetes, so I've decided to make some healthier choices. Okay. So I start my breakfast with having some eggs, which is high protein, and also having some bread, which is seeded bread.
So the eggs, are you boiling the eggs? Are you frying that? What are you doing?
Absolutely. So either I go for a boiled egg, or I'll go for a scrambled egg or a fried egg. It doesn't matter as long as I'm using the right type of oil. So the better oils are things like rapeseed oil or olive oil, which are better type of oils. Then I will have some seeded bread. Some people will, opt for no carbohydrate or low carbohydrate. That is entirely, the healthier carbohydrates we eat, the better. So seeded bread, whole grain bread, or I might choose a porridge in the morning with lots of berries, seeds, nuts in there to make it wholesome. Moving on, I might have a snack in between if I'm hungry. My snack will only be a few nuts. That's the only thing I will snack on. So almonds, Brazil nuts, walnuts, cashew nuts, or I might have some pumpkin seeds. Now, I generally tend to buy mixed nuts because it's much more cost effective. And then for lunch, I will have either a salad with some hummus, some chickpeas, or some leftover dal. If there's some chicken in the fridge, there's many times I will just warm up some curry, and if there's no curry, I'll just have some salad with some fish or chicken. Very light lunch. I always try to have some dairy food in the form of yogurt, cheese, or milk with my lunch, because it's very easy food to miss out, and that very important calcium from dairy foods is just what we need in between our meals. Then if I want a cup of tea, I would have some herbal teas. I try to drink very less caffeinated drinks now, because that really improves our gut movement, our gut bacteria. And lots of people complain of, bloating, wind, and also they feel like they're really lethargic. So if you reduce your caffeine intake, this can be quite beneficial. And then I try to snack on some fruits. So I'll have some berries at the moment. A pomegranate is very, very popular. Or I might have some strawberries. And so I like to snack on lots of berries. Or occasionally a banana or an apple. So fruits is something that I really do enjoy having. Many people say that, they don't like fruits or children don't eat fruits. But I think if you offer it, if you cut it up, it's easier to have. I'm not a big fan of smoothies. I don't like blending things. I like to chew. I like to enjoy my food. And then for dinner, I like to have a proper desi meal. I have young family.
That's the crux of the matter, is the dinner. Yeah.
I am very desi when it comes to dinner. So I make chapatis, parathas, rotis. We choose a combination of, sometimes we'll have whole grain, we'll have multi-seeded atta. We've tried lots of different varieties. And then there's always a dal or a sabzi, and occasionally we'll have some kind of meat or chicken or fish. But we have a choice of masoor dal, mung dal, chana dal, and there's always a variety. And this is a very cost-effective way of being healthy. And then when it comes to salads, we have plenty of salads with our evening meal, and that keeps us full. It prevents us from feeling that excessive, indigestion with too much spice or too much fried food. And then occasionally we will have, a treat such as, we'll have fried chips or fried chicken or fried fish.
Really?
And it's absolutely fine if you're preparing it at home with very limited oil, and if you do it on a regular basis with fresh oil, clean oil. Because remember, you've got to remember that when you're eating out, you don't know how long they've been using this oil for, or whether the food is actually
that's
as fresh.
true. That's true.
There's lots of things that we've got to think about when we're eating out.
Let me throw a couple of other, what do they call them? Boomerangs at you. Right?
Go ahead.
One is snacking in the evening. That's a big issue, right? Because our families, we stay up quite late, yet we still get up in the morning, mashallah, but you get ready for a snack and this. Number one, fizzy drinks and all this. And the other thing is, what about that thing like eat like a king for breakfast like a king, lunch like a, what is it? Prince.
So a king, prince,
and then,
queen.
the pauper.
So your breakfast should be your main meal.
Whereas our meals, it's like the evening meal is our main meal. That's where we really, and then we go to bed.
So if you think about the evidence from intermittent fasting, or we're looking at how we can feel better, lose weight, there is evidence to say that you reduce the number of hours that you eat. So if you choose not to eat for breakfast, there are some benefits to it. But our breakfast gives us really crucial nutrients. So, the protein in the eggs and the vitamins and the iron and the minerals in our porridge and seeds. A lot of the breakfast cereals are fortified. So missing out that breakfast is really, really, not ideal, particularly for children, because that concentration level is really important. Now, going back to, what for snacking, the ideal thing is try not to buy so many snacking foods, because if it's in the cupboard, you're going to grab it. So when I'm helping families or encouraging people about healthier lifestyles, it's always a good idea to buy healthier snacks in the house. So those nuts, those seeds, those berries, making your own protein laddus, like you said, made out of nuts and dates, and avoiding that extra biscuits, chocolates, crisps that we don't need. They give us no nutrition. Unnecessarily, they're in our cupboard, and they contribute to weight gain, and they also contribute to long-term conditions such as heart disease and diabetes, because these foods have a lot of saturated fats in them, and saturated fats are the cause of a lot of these conditions that we're seeing. And the other concern I have is that lots of people, lots of young children, families, they often offer these things as treats. And what we're seeing is a lot of obesity in young children, teenagers, purely because they're not eating the right foods, and they might be snacking on a packet of crisps or a chocolate bar, or, that bedtime Cocoa Pops. Whereas if we avoid buying these things, children are more likely to eat better foods, wholesome, healthy foods, which are actually going to benefit them in the long term.
And look, on the other side of the coin, are there certain communities like Mediterranean that are eating better and less at risk?
So if we have a look at the evidence that comes from the Mediterranean diet, this is very much a historical, way of eating. When we have a look at the Greek diets, the Mediterranean diets, what is it that is good about these diets? So we've got olive oil, olives, whole nuts, we've got Brazil nuts, walnuts, feta cheese, lots of dairy foods, very little carbohydrates, lots and lots of fresh vegetables, tomatoes, herbs, lots of green vegetables. And that is what brings, the goodness of Mediterranean diets. And if we think about it, lots of good oils. So you've got lots of olive oil, use of, olives in their diet. And these are good fats. And the good fats is what is going to help us in the long term to protect our heart, to protect us from long-term diseases such as diabetes. But what we see in the South Asian community is that generally our food is good, but possibly it could be the portion sizes, that we're eating far too much rice, rotis, potatoes. And then, we are snacking heavily if we think about the snacks that we have, and then the celebrations that we have. But it's not to say that we can't enjoy ourselves, but we do have to be a bit more mindful of what we eat, how much we eat. Ultimately, it is our body. We have to look after it. What we put inside it that's what we're going to get.
And look, on that note, I mean, looking across the spectrum of different communities, is there a time that we should be having dinner and nothing later? Because, we do have dinner very late, whereas many people in the other parts of the community have dinner like 6 o'clock, and you're like, what, 6 o'clock? Whereas 9, 10 o'clock is when we have dinner. If you go to Pakistan, for argument's sake, or go down to, before the lockdowns, walk down Southall or Ilford or whatever, restaurants are buzzing at 10, 11 o'clock at night.
Again, this is a very much a society, the way we live our society. We cannot dictate people how they want to eat and how they want to live their life or what they want to do. But what we can tell them is the right way to do things and make some choices. Eating late, yes, that can have some implement on the way we, our metabolism. And also, we've got to remember, once we've eaten our evening meal, we're very sedentary. We're not doing any activity. Are we using up that energy? And a lot of that energy is going to turn into fat. But whereas when you eat earlier and you're still active, you're using that energy that we need is going to be used up as glucose. But if we don't use up that energy, it's stored in our body as fat. And that's why intermittent fasting is very, very successful with people in terms of weight loss and improving reducing their risk of developing type 2 diabetes. Because if you are fasting for a longer period of time, your body will turn to the fat and turn that fat into energy. So you're basically going into starvation mode and using up your fat. So there's no right or wrong answer to how late or how early we should be eating. As long as we eat the right foods in the right quantity, you could have a steak at 10 o'clock at night. As long as you are eating it in the right amounts, you've cooked it in the right way with plenty of vegetables, I don't see there's anything wrong with that. But if you're having a large plate of rice with lots of chapatis, then that carbohydrate is going to be stored as fat. And that's what we've got to remember, is however we eat, we've got to be mindful of our portions. We've got to be mindful of the good fats that we eat. Always encouraging families to eat plenty more vegetables, dals, nuts, proteins. The less saturated fats we eat, the less processed foods that you are buying, the better for you, the better for family. And the whole purpose of the Healthier You campaign is really to increase the awareness of eating better in the South Asian communities, in the African communities, in the Black Caribbean communities, and also avoiding the risk of developing type 2 diabetes. We've seen time and time again that there are huge variations, inequalities amongst these communities. We're hearing that why is it that these communities have type 2 diabetes? Why are we suffering more during a pandemic such as COVID-19? But it has to be dealt with within the community. You know, I really want to send out these messages to these communities that it is high time that we take advantage of these programs, get our risks done, get the calculator out, get your waste measurements down, and you know, sign up to these programs that actually can make a big difference to our life and prevent the onset or delay the onset of these awful diseases such as type 2.
Dr. Salma, absolutely brilliant having you. You've been really practical, and that's what's always so important. Jazakumullah khair for your fantastic advice and taking some of the challenging questions. You're ready for them all. Allah bless, inshallah, and keep you and your family in good health. And also, let's hope that people that are watching tonight will, inshallah, take benefit from your advice, inshallah, and use some of those tools to try and prevent diabetes type 2. Jazakallah khair. Assalamu alaikum.
Assalamu alaikum. Wa alaikum assalam.
Living the life.